Everything has to be paid for. Syria destroyed 60% of its hospitals between 2011 and 2020, not all at once. Gradually, systematically, facility by facility, until a country that once had 2,500 functioning hospitals was operating on fewer than 600. The immediate cost was measured in lives, but the economic cost, the one that persists long after the last strike on a medical facility, is measured in something else entirely. Lost doctors who emigrated, rising chronic disease rates, falling life expectancy, reduced workforce productivity across an entire population. A healthcare system is not just a place where sick people go, it is economic infrastructure, one of the most expensive to build, the slowest to replace, and the most consequential to destroy. This episode examines how the collapse of healthcare systems in conflict zones functions as a long-term economic weapon, why the costs compound across decades, and why rebuilding a hospital is only the beginning of what must be paid for. Destroy a factory, the economy loses output. Destroy a healthcare system, the economy loses its ability to produce output at all. The scale of medical destruction. Healthcare infrastructure is among the most targeted in modern conflict and among the most expensive to replace. A functioning hospital of 200 beds costs between $100 million and $300 million to build, depending on capacity and equipment. It requires years of planning, construction, and staffing. It can be rendered non-functional by a single strike. The World Health Organization tracks healthcare facility destruction across conflict zones. In Syria, between 2011 and 2020, WHO documented over 600 attacks on healthcare facilities, making it one of the most systematically targeted civilian infrastructure categories in the conflict. By 2020, Syria's operational hospital capacity had fallen to approximately 40% of pre-conflict levels. The physical destruction cost alone, replacing buildings, equipment, and supplies, was estimated by the World Bank at $4.5 billion to $6 billion. Yemen presents a parallel trajectory. The WHO documented that by 2020, fewer than 50% of Yemen's health facilities were fully functional. The UN Office for the Coordination of Humanitarian Affairs estimated total healthcare infrastructure damage at $1.5 billion to $2.5 billion. But these figures capture only what was destroyed. They do not capture what the destruction prevented. The doctor exodus. A hospital is a building, but a hospital without doctors, nurses, and trained staff is concrete and equipment. The human component of healthcare, the workforce, is the most irreplaceable element, and it is the first to leave when conflict begins. According to WHO data, Syria lost an estimated 30% to 40% of its pre-conflict medical workforce between 2011 and 2020. Doctors emigrated to Lebanon, Turkey, Germany, and Gulf states. Nurses left. Pharmacists, technicians, and administrative staff dispersed across the region. Each departing medical professional represented not only their own productive capacity, but the capacity to train and support future medical workers. The IMF's Human Capital Framework estimates that each doctor who emigrates from a conflict-affected country reduces long-term healthcare capacity by a factor of 3 to 5, accounting for the patients they would have treated, the trainees they would have supervised, and the institutional knowledge they carried. For Syria, losing 30% to 40% of its medical workforce translates into a healthcare capacity reduction that will take 15 to 20 years to reverse, even under stable post-conflict conditions. They said medical professionals would return to conflict-affected countries once security conditions improved and reconstruction began. They got return rates below 10% among Syrian doctors as of 2023, according to Syrian Medical Association tracking data. The professionals had built careers, families, and practices abroad. The origin country's healthcare system lost them permanently. The chronic disease cascade. When healthcare systems collapse, the consequences do not remain confined to acute emergencies. They cascade into chronic disease, reduced life expectancy, and long-term productivity loss across entire populations. Preventive care stops, vaccinations are interrupted, chronic conditions, diabetes, hypertension, cardiovascular disease, go unmanaged. Mental health services disappear entirely. The result is a population that becomes progressively less healthy over years, not weeks. The WHO's assessment of post-conflict health trajectories shows that populations exposed to healthcare system collapse for more than 2 years experience measurable increases in chronic disease prevalence. Cardiovascular disease rates rise by 15% to 30%. Diabetes incidence increases by 10% to 20%, and mental health disorders affect 20% to 40% of the population, according to studies conducted in post-conflict Iraq, Afghanistan, and Syria. Each percentage point increase in chronic disease prevalence reduces workforce productivity. The World Bank estimates that unmanaged chronic conditions reduce productive capacity by 5% to 15% per affected worker annually. For a population of millions affected by healthcare collapse, the aggregate productivity loss runs into billions of dollars per year, a cost that persists long after physical facilities are rebuilt. They said rebuilding hospitals would restore healthcare capacity and reverse the health impact of conflict. They got a population with elevated chronic disease rates, a workforce with reduced productivity, and a healthcare system that must simultaneously treat existing patients and rebuild institutional capacity, a cycle that extends recovery timelines by a decade or more. The life expectancy calculation. Life expectancy is one of the most consequential economic indicators a country can lose, and healthcare system collapse is one of the most reliable mechanisms through which it falls. According to the Institute for Health Metrics and Evaluation, life expectancy in Syria fell from approximately 74 years in 2010 to an estimated 54 to 58 years by 2020, a decline of 16 to 20 years in a single decade. Not all decline is attributable to healthcare collapse alone. Direct conflict mortality contributed significantly. But the WHO estimates that healthcare system failure accounted for 30% to 40% of excess mortality during this period, deaths that would not have occurred if functioning medical infrastructure had remained available. Each year of reduced life expectancy represents lost productive years. The OECD's framework for measuring human capital values each productive year of life at $50,000 to $100,000 in economic output for middle-income countries. A population-wide reduction of 16 to 20 years in life expectancy, applied across millions of people, generates a permanent reduction in national human capital that runs into the hundreds of billions. The mental health cost. Mental health is the least visible and most persistent consequence of healthcare system collapse in conflict zones. It is also, in economic terms, among the most costly. The WHO estimates that 20% to 40% of populations in prolonged conflict zones develop clinically significant mental health conditions, post-traumatic stress disorder, depression, anxiety disorders, and complex trauma responses. In most conflict-affected countries, mental health services are either non-existent or severely underfunded. Treatment rates remain below 5% even in post-conflict recovery periods. Untreated mental health conditions reduce workforce productivity by 20% to 40% per affected individual, according to research published through the Lancet Commission on Mental Health and Global Development. For a population in which 25% of adults are affected and treatment rates remain below 5%, the aggregate productivity loss is enormous. The World Bank has estimated that the economic cost of untreated mental health in conflict-affected populations runs between $500 million and $2 billion annually for countries with populations above 5 million, a cost that persists for decades beyond the conflict itself. They said, post-conflict recovery planning would address mental health as part of broader healthcare reconstruction. They got mental health services receiving less than 1% of post-conflict healthcare budgets in most recovery plans, according to WHO funding tracking data. The cost was deferred. The population paid it in reduced productivity, reduced capacity, and reduced economic output, year after year. The pharmaceutical and supply chain collapse. Healthcare systems depend on continuous supply chains for medicines, medical devices, diagnostic equipment, and laboratory supplies. When conflict disrupts these chains, through port destruction, sanctions, or trade route disruption, the consequences compound the damage from physical facility destruction. Syria illustrates this mechanism. Prior to the conflict, Syria imported approximately 80% of its pharmaceutical supply through established distribution networks. By 2014, those networks had collapsed. Medicine shortages affected 90% of the country's healthcare facilities, according to WHO procurement data. The cost of replacing domestic pharmaceutical supply through alternative channels, air shipments, third country routing, and emergency procurement ran 3 to 5 times higher than pre-conflict baseline costs. The World Bank estimates that pharmaceutical supply disruption in conflict-affected countries adds $500 million to $2 billion in annual healthcare costs, beyond the direct infrastructure damage, costs that persist as long as supply chains remain disrupted. For countries dependent on imported medicines, this disruption is not a temporary inconvenience. It is a structural barrier to healthcare delivery that persists even after physical facilities are restored. The long account. A healthcare system is not rebuilt in a year. It is not rebuilt in 5 years. The physical structures can be replaced in 3 to 5 years with sufficient funding, but the workforce takes 10 to 15 years to retrain. The chronic disease burden takes a decade to reverse. The mental health consequences persist for a generation, and the life expectancy loss, the permanent reduction in productive human years, cannot be reversed at all. Syria lost 60% of its hospitals. The physical rebuilding cost runs to $5 billion or more. But the total economic cost, workforce loss, chronic disease, mental health, reduced life expectancy, and productivity drag, exceeds $50 billion over a 20-year horizon, according to World Bank recovery cost frameworks applied to Syria's specific conditions. A factory can be rebuilt and resume production within months. A hospital can be rebuilt and remain understaffed for a decade. A population can be physically housed and remain economically diminished for a generation. Healthcare is not a luxury expenditure in a national budget. It is the foundational infrastructure of economic productivity. Destroy it, and you do not just harm the present, you impair the future, permanently, measurably, and at a cost that no reconstruction budget will ever fully capture. Subscribe to the price of conflict, because the most expensive infrastructure to destroy is not the one that makes things, it is the one that keeps the workers healthy enough to make anything at all.